Hi, I'm Dr Meyerkort from Perth Orthopaedic and Sports Medicine, and today we're going to be talking about robotic knee replacement surgery. Robotic knee replacement is when there's a robotic arm that aids in the cutting of your bone. All of the soft tissue dissection is still done by your surgeon in the usual manner. Just to give you a little further understanding of how knee replacement has evolved. So conventional knee replacement is done with instruments. The instruments essentially are rods that align off your bone, and we cut according to those jigs and rods that we're using. In the early 2000s, a technique came out called computer navigation. This essentially registered where your bone was in space and allowed us to cut the bone according to the plan that we determined with computer assistance. Robotic surgical techniques are the evolution of computer navigation. We still register where the bone is in space. We still plan where we're going to cut the bone with computer assistance, but the physical cutting of the bone is aided with a robotic arm, which is attached to your bone. Does robotic assistance improve outcome is a very interesting question. With partial knee replacement, the Mako robot has been shown in the Australian National Joint Registry to decrease the rate of revision or redo surgery. With total knee replacement as of 2023, there has not been a reduction in revision with robotic assistance compared to conventional techniques. Having said that, since 2020, robotic knee replacement has been routine for all partial and total knee replacements that I've done privately. In my hands, the surgery is more predictable. I can fine-tune the plan a little more, and I find that it makes it easier to achieve a well-balanced knee throughout the range of motion. My background was I was using computer navigation beforehand, and I found robotic techniques to be an extension of this surgical technique. Having said that, if I had a family member that was having a knee replacement and it was being done by a surgeon that did not use robotic surgical techniques, I'd have no hesitation in allowing that surgeon to do that surgery if it was a colleague that I knew and trusted to do a good job. So in summary, robotic surgical techniques certainly is quite widespread at the moment, and in my hands it makes surgery more predictable and it makes it easier to get everyone into where I think their knee should be.